Hello, everyone. Good evening. So today we're going to hear about equine asthma from Dr. Joy Tomlinson. So Joy, of course, is a veterinarian. She's also boarded in large animal internal medicine. And if that isn't impressive enough, she's also now pursuing her PhD. She has the little symbol down here of the lab she's in. She's in Gerlinda Vanderwaal's lab at the Baker Institute at Cornell. And she's an expert in a lot of things. You may recognize her if you've been a long time attendee. She gave our gastric ulcer talk last year, and now she's going to explain equine asthma to us. And in addition to, of course, being a specialist veterinarian here at Cornell and pursuing her PhD, she's also a horse enthusiast, like many of you, and owns a couple horses and is also now managing a barn. So she's has a lot going on, and she's I appreciate her taking the time out today to explain equine asthma to us. And I think Sarah just has a couple of housekeeping announcements, and then we can get started.
Yeah, thanks. Welcome, everybody. Feel free to use the chat and also the question and answer box. Thank you to everybody who submitted questions in advance via their registration. I think a lot of those questions are going to be covered in the presentation, but we will get to any others that may come up after Joy gives her presentation, so at the end. I wanted to let you guys know that next month the topic is going to be emerging equine infectious diseases, and that's going to be given by Dr. Toby Pinn Woodcock, and you will receive notification of that, and it's on our website and whatnot. So if you have any questions for Lindsay or myself during the presentation, please feel free to message us. I think we're ready to go.
Okay. So the topic of the day is asthma. And I have to say this is somewhat personal for me because I have asthma myself and I'm allergic to all the things that trigger horse asthma. So I can tell you how it feels. But I'll focus on horses for today. So to start out with some terminology, we call the condition asthma now, but it has had many names over the past. So you might know it as HEAVS or COPD, which was chronic obstructive pulmonary disease, or RAO, recurrent airway obstruction, or IAD, inflammatory airway disease. And in the last few years, a whole group of veterinarians got together and reviewed the existing data and decided that really this is asthma, the same as people have. And that calling it all the same thing helps us understand it better and draw corollaries to what's going on in people. So now all of these things are most correctly currently called asthma. And instead of having all those different names, now we have different severities of asthma. So mild asthma used to be called IAD, or inflammatory airway disease, and this is usually a condition of poor performance rather than obvious breathing difficulty. And then moderate asthma falls somewhere in between the two, where they have poor performance and they may also have a frequent cough, but again, they're not standing in the stall breathing hard. And then severe asthma is our classic HEAVS horse, where they just standing in the stall will have flared nostrils, breathing really hard. They may get what we call a heave line, where you see a prominent a sort of dip at the bottom of their rib cage, and that's because actually their abdominal muscles have bulked up just from the effort of breathing. So when you look at that, you should think that that poor horse feels like he's done like 500 sit-ups because his abs are working so hard to breathe. So that's really an indication that the horse is probably uncomfortable and really needs intervention. So mild asthma, again, it used to be called IAD. Typically, you figure out the horse has a problem because they have poor performance. And because of this, we often diagnose it in race horses because they're exercising to their maximal capacity. You'll also see it in barrel racers. You may see it in event horses, anything where the horse is really working strenuously. They may have some degree of nasal discharge, and this is typically a clear serous discharge or maybe a white discharge, and they may or may not have some degree of cough. And it's important to remember that although these three severities, or two major severities, mild and severe, are under the same umbrella term of asthma, it's not necessarily a progression. So if a horse has mild asthma, it doesn't mean that over time they're going to progress to severe asthma. And you'll see the same with people. Some people have a mild version and some people have a really severe version. It doesn't mean that they're going to go from mild to severe. In fact, horses with mild asthma, especially these race horses, often tend to cure or resolve completely within a few weeks to a few months. And so this may be, again, more like childhood asthma, which can resolve with time. And then when we talk about this sort of classic case of severe asthma, which used to be called COPD, RAO, or HEAVES, we're typically talking about older horses, so they're full adults, they're at least 7 years old, if not older. And it's usually associated with poor air quality. So horses that are brought into a barn during the winter, they're fed hay, all the doors are closed because it's cold outside, and there's a lot of dust and particulates in the air that they're breathing in. Round bales are also often attributed, but any sort of feeder where the horse is sticking their head in and burying their head in hay. So if a horse was smart and just ate the tip of the round bale, it wouldn't be a problem, but you guys have probably all seen them. They tend to dig a little hole and eat their way in until their whole head is buried and they're just breathing in all of that dust. And then also if you get like a bad moldy bale of hay that you miss or something, that can trigger some asthma. And then there is also a genetic predisposition. This is again like people, allergies and asthma run in the family, but it doesn't mean that if the parents have it, the foal will definitely have it. It just means if you have the choice between breeding an asthmatic horse and a healthy horse, I would breed the healthy horse. But that's up to you. If other things outweigh it, you can take the risk. So then the one wrench in the plan of all the treatment we're going to talk about is that there is this syndrome of summer pasture associated severe asthma. So I just told you that asthma is usually associated with pulling the horse into the barn and having an enclosed space and feeding hay. But there's this subset of horses that will be out in a beautiful field doing everything that we think we should be doing, and they'll get asthma out there. And this is typically in hot, humid areas of the US, and that's the Southeast in particular. And it's partly because of the humidity itself, which breaks down pollens into smaller particles so they get inhaled deeper into the lungs. The humidity also helps release fungal spores from the grasses that can trigger asthma. But it's also the types of grasses that grow in the South. So there are certain grasses that the pollens are just more allergenic, or the grasses support specific types of fungal growth that aren't toxic to the horse, but are more likely to promote asthma. And so those types of grass are Bahia grass, Bermuda grass, and Johnson grasses in particular. And those just don't grow in the Northeast or in the Western part of the country as much. So we don't tend to see this type up here at Cornell as much, although we can get some cases. So if the horse has the major asthma in November, bring it in the barn, then you're thinking about this summer pasture type, and a lot of our management recommendations have to change for these horses in particular. So I'm not going to talk about them too much more, but if you have an asthmatic horse of your own and it fits this pattern, then you'd have a different conversation with your vet about some of the management choices. So what is happening in asthma? What is causing it? Basically, the horse is breathing in millions of these fine particles, dust, fungal spores, pollens, certain toxins, gases like ammonia from the urine in the stalls. All of these particles get inhaled and get all the way down into the lung. And then some horses have basically an aberrant immune response that is a type of allergy that causes activation of neutrophils, which are a certain type of white blood cell. And this is one area where horses are a little bit different than people. So people can have neutrophilic asthma, but it's less common than other types. And this is the unique part that makes horses not really respond to antihistamines or typical allergy medications, is this is a slightly different route of allergy. So in addition to having this inflammatory cell infiltrate, they also get excess production of mucus, and that's the body trying to kind of flush out all of these particles. And then the airways themselves, which should be nice and thin and open, will thicken and spasm, and they'll close down. And so it gets really hard for the horse to move air through the lungs. And that's why you'll see this increased effort of breathing, especially trying to push the air out. It is really hard. And then in terms of what triggers it, what makes a horse have asthma, because all the horses are breathing these things in. Part of it's genetic predisposition. That's probably the main thing. And a lot of factors we don't really understand otherwise. People always ask, like, could it be a bacterial infection or a viral infection? And those can kind of trigger the start of the pathway or trigger a bad episode to start. But usually the horse has some underlying predisposition. It has some underlying abnormality already. And so it's not that the infection causes asthma, but it can exacerbate it, if that makes sense. And you'll see the same thing in people. So if your horse is having signs of heavy breathing or poor performance, and you want to figure out, does my horse have asthma? The first thing a vet's going to do is come out and look at your horse in the field probably, and start with a good physical examination. And so things that we're looking for that fit with asthma are, particularly with severe asthma, would be flared nostrils, increased breathing rate, increased effort. So you could see their little belly contract as they're trying to breathe out. They might have that heave line we talked about right at the base of the rib cage. If you, a bad horse may be coughing on its own, or if you squeeze the trachea, squeeze the windpipe a little bit, if it's irritated, then they may cough. They may have nasal discharge. Again, this is often that kind of really white discharge on a horse in the nose after you've been riding the horse, or clear. If it's like green snot, that's usually not asthma. And then really severely affected horses can also have weight loss, partially just from the energy spent breathing, but also because they're trying to so hard to breathe, they don't really have time to think about eating. A typical asthmatic horse should not have a fever. If they have a fever, that's probably a sign that something else is going on. Now, if it's a mild asthmatic case, there may be no signs on our physical exam, and you'll definitely need additional testing. And then in particular, we listen to the lungs, of course, which is what this doctor here is doing. And we listen for abnormal sounds. So a normal sound should be clear breathing, like wind through a pipe. And in an asthmatic horse, you may hear crackling or crinkling sound if there's a lot of fluid buildup, or most typical is to hear a wheezing sound, exactly the same as asthma in a person. And when you go to the doctor, your doctor will ask you to take a deep breath, so they listen. We can't tell horses to take a deep breath, so we do what's called a rebreathing exam, where we put a big bag over the horse's nose. They breathe their own CO2, and it makes them breathe deeper and slower. And so they take those breaths that we can hear the lung sounds better. And then if we think it's asthma, or if we're a little confused, we often want to run some blood work, because some of the treatments we use are immunosuppressive. So we want to be really sure they don't have any sort of infection going on before we treat them. So at this point, if the history fits, if the clinical signs fit, if our physical exam fits and the blood work is pretty normal, we might be comfortable saying, yeah, we think your horse has asthma, let's try treating. If it responds, then that we're pretty sure about the diagnosis. But if there's anything funny, if the horse has severe weight loss, if the horse has a fever, if the horse has inflammation on the blood work, or if you try treatment and the horse isn't responding, then it's really important to do additional tests. And some of the reasons are because there are other diseases that can look a little bit like asthma and can confuse the picture. So for mild asthma, particularly racehorses get this other condition called exercise-induced pulmonary hemorrhage. They're also known as bleeders. Barrel racers can also get this too. I've seen it in a random horse that just ran like a nut out in his pasture one day. So this is associated with intense exercise, and basically some blood vessels in the lungs burst and they bleed into the lungs. This picture is showing a more severe case where you see a bloody nose, but often you don't. And so you may just see poor performance, and it's because they're bleeding deep in the lung. Again, if poor performance is the main complaint, we have to rule out musculoskeletal disease, so lameness, muscle injury, other upper airway problems. And then if cough is the main complaint, sometimes a recent viral infection or recent bacterial infection just in the trachea and the windpipe can cause a chronic cough for a while that just needs time to resolve. If you're talking about severe asthma, particularly if there's a fever or weight loss, then, or the blood work shows signs of inflammation, then you would need to rule out equine multinodular pulmonary fibrosis, which this is a picture of the lung is basically gets filled with scar tissue, and it's associated with a herpes virus infection, herpes virus 5, which is not the same one that you're hearing all these neurologic disease outbreaks about. So EHV5 usually doesn't cause any problems for the horses. You'd never know it's there. And then a rare horse will get this complication of EMPF. And then pneumonia or bacterial infection, we also want to rule out. And sometimes that's there on its own, and that's the problem the horse actually has. But sometimes you have a horse with asthma that gets a secondary bacterial infection that you need to clean up before you can treat the asthma. So the additional diagnostics that we do to make sure none of these other things are going on and to confirm that asthma is the real problem. The first one we often start with is ultrasound of the chest. This is something that we do every time we have a horse come into the hospital for respiratory disease. And ultrasound can't go through air. So for ultrasound, we're just looking at the surface of the lung. So this bright white line is where the ultrasound beam stops. The probe will be up here on top. And it should be a perfectly smooth white line. And in a horse with asthma, you can get some roughening of this edge because of inflammatory cells and a little bit of fluid. And you'll get these white streaks going down that are called B lines. And so this would be a typical severe asthma case where you see some of these B lines. In a mild asthma case, you might see just a very few of these, or you might see a pretty normal ultrasound. But you shouldn't see any big black areas, which would be consolidation that would be more consistent with that EMPF or pneumonia. So this is more to rule out other diseases than to tell you definitely it's asthma. Similarly, we do chest x-rays, again, not in every case, but chest x-rays we use to see deeper into the lung. So again, that ultrasound only sees the surface, but if there's something like a lingering lung abscess or that EMPF isn't always seen at the surface, then the chest x-ray will let us see deep into the lung. And this one definitely has to be done in the hospital because the horses are big, of course. And so we need these overhead x-ray units to get all the way through the horse and get a good image. And you'll see this window here of bright light is showing you where you're getting the X-ray picture of, basically. So you can see that we end up having to take a bunch of different pictures to get the whole lung field, which kind of covers this area of the horse, most of the horse. And then looking more directly into the lungs, we do what's called endoscopy. And so this is, we stick a long flexible camera up the nose of the horse and back into the trachea, into the windpipe. And one of the things we evaluate is the amount of mucus in the trachea. So a normal horse should have no mucus or a couple little flecks. And then as the inflammation increases, you'll see more and more mucus pooling in the trachea. So we can score that, and that correlates somewhat to the amount of inflammation in the lungs. If there's any concern that the horse might have a bacterial infection, at this point we would take a sample of this fluid and culture it to see if there's any infection there. And then the definitive test to say, yes, this horse has asthma is actually the bronchoalveolar lavage. So we keep sending that tube all the way down the trachea, down to where the airways branch off into the bronchi, or into the smaller branches that go out into the lung. And this is an example of a normal horse. You see nice open airways, smooth lining of the airway. And for the lavage, we instill a bunch of fluid and then we pull it back out and look at the cells that come out. And you see you have not very many cells, and they're these bigger epithelial cells and other things. And so this is a horse that's living out on pasture in our sort of ideal management conditions, minimal dust, minimal exposure to allergens. And then this is that same horse after you bring it into a barn. You can see the airway is a little bit smaller than it was there, but still pretty nice and open. And the cells, there's not too many more. In comparison, this is a horse with asthma. This is, again, if it's in our, quote, ideal management conditions, you can see that it already looks like the walls here are a little bit thicker than the normal horse, and it looks a little bit more closed, and there's more cells in that fluid. But this is basically an asthma horse in remission. And then this is a few hours after you bring that horse into a barn and feed it a bunch of dusty, fluffed up hay. And you can see that this narrows down a heck of a lot more. You can imagine trying to breathe through that much smaller an airway. And when we look at the cells, it's chock full of these little tiny neutrophils everywhere. And so this would be a diagnostic sample for asthma. So once you've decided that, or once your vet has decided that your horse definitely has asthma, then we have to figure out how to treat it, right? And so I'm gonna harp on this. The number one treatment should be environmental management. For long-term control, this is the most important thing to do for your horse. And that involves removing all the triggers that you can, which usually means the best thing is for the horse to live 24/7 outdoors and never come into a barn. And that's easy enough for me to say and much harder to do, right? So we will usually tell you what the ideal is, and then you and your vet should work together and figure out, well, what's actually feasible in my situation, right? So ideally they're out here eating grass, never get any hay. Well, that doesn't work so well in upstate New York in the middle of winter. There's no grass to eat, right? They have to eat something else. So we start from best case scenario and then try to manage everything else as best we can to improve the horse's situation. So if the horse has to come into a barn, some things that you want to think about are where the hay is stored. Hay is one of the biggest culprits. And in particular, having a hay loft, it just means that there's hay dust in the air and it goes away. So if you can move to a barn that doesn't have hay stored in the barn, that would be really important, probably the most important thing to do. Additionally, the type of bedding that's used in the stalls is important. Straw is essentially hay, so straw bedding is terrible for a horse with asthma. Shavings are better, but the best is actually using a shredded paper or cardboard bedding. And then you have to think about how you manage the horses and their time in the barn. So we have a lot of activities that stir up dust. We sweep the aisle a lot, we muck the stalls out, we toss hay in when we're feeding, especially if you have to put it in one of those overhead feeders. All of that kicks up these triggers for asthma. And once you kick up that dust, it actually lingers in the air for hours. So the best thing to do would be to get the horses out of the barn, turn them out for the day, and then do all your chores right away. So do your mucking, sweeping, putting hay in the stalls while the horses are still out for a few hours. That gives everything time to settle down before they have to come back in the barn. The other thing you can do is you can like dampen the aisles or sprinkle a little water on before you sweep to reduce the amount of dust you kick up. And you really shouldn't use any of the leaf blower type attachments to clean the barn because that really kicks everything up. And then another really hard thing is you want to improve the ventilation as much as possible. And this is hard for people to do. And if you're in a boarding facility, it can be hard to convince your friends and the barn manager. But the best thing is to leave all the doors open, even in winter, and leave the windows open, leave the Dutch doors open, and have as much airflow as possible. And obviously, if it's raining sideways in the barn aisle, that doesn't work. But as much as you can convince people to leave things opened up, it's better. The horses don't need the extra warmth unless they're clipped, but if they're clipped, hopefully you have blankets on them and they'll do fine in the colder weather. It's just us people who get all cold. So those are some of the things you can tackle. Again, I know it's hard if you're in a boarding facility, but you do everything that you can to make it better. And then the rest will be medication. Sorry, one more aspect that you control in their environment is the feeding. So again, ideal is on pasture as much as possible. When they're not on pasture and they're being fed hay, you want to try to reduce the hay dust as much as possible. So again, no round bale, no giant feeder where their nose is in the hay. And then to reduce the dust, you can wet the hay. Putting it in a tub like this is a good idea because you want the water to get all the way through the flake, but you don't want to leave it to soak for a long time because that actually leaches out a lot of the nutrients. If you have a fat horse, go ahead and soak it. That'll help them lose weight. But if you don't, then you just want to wet it down and feed it right away. And again, this can be a problem in the middle of winter when it's, negative 10 degrees out. And so there are some products, and the Haygain is the main one, and I have no financial interest in them. But it's basically a steamer for the hay, so it gets everything moist without you having to use a whole lot of water. And they have pretty good data backing it up that it reduces a lot of the inhaled particles that the horses are exposed to. And this also shows the hay and hay nets, and using hay nets can again keep the horse from burying their head in the hay. So that can be a good idea. Now, for some horses, even this isn't enough to control their signs, and they may have to go on an all pelleted diet. And for this, I really recommend using a commercially produced complete feed. So a lot of senior feeds are complete feeds, but there are also complete feeds for active horses that have a higher caloric content and protein content for an active exercising horse. And the complete feeds are designed to have all the fiber needed to keep the horse's guts healthy, as well as the right nutrient and mineral balance. A lot of people in the pre-submitted questions were asking about beet pulp. Beet pulp is recommended because it's a fiber source that doesn't have the dust of hay, but it's not a complete balanced diet. So I would stick to the complete feeds. Most of them are actually based on beet pulp, so you're getting whatever benefits there are from beet pulp. But this is really the best way to go to make sure your horse is getting everything they need. So then once you've done everything you can to manage the horse's environment, then we have to go to medications. And we use medications in an acute flare-up to get everything under control, or when you're first diagnosing your horse, you use medications. If you can manage their environment, ideally for what that horse needs, they may be able to come off. You'll never cure the disease, but you may be able to manage it just by changing their exposure to their triggers. But some horses do stay on medication pretty much lifelong. And so there are two big classes that we think about for medications. There's one set that we use to relieve the symptoms and make the horse more comfortable in the short term. And then there's one set that we use to actually treat the disease and reduce the inflammation. So when we talk about relieving symptoms, these are the equivalent of a person's rescue inhaler when they have asthma. So we can use, it's called albuterol is the actual medication. We can use the same inhaler that they give people. And there's a variety of different companies that make these sort of spacer devices that allow you to create a seal over one side of the horse's nose. You wait until they're breathing in and you give a puff of medication. So that's one method that's used quite a lot. The advantage is the medication goes straight into the lungs rather than into the whole horse. But these are pretty expensive. Another approach is to use what's called a nebulizer. So again, also for people, if you have a severe asthma attack, they will nebulize the albuterol instead of give you the puffer. And it kind of steams the medication. So you breathe in and out with this medication in the device. So it gets distributed into the lungs better, I would say. But this nebulizer that you would have to buy for your horse because you're going to be using it frequently is pricey. It's like $1,000 or something awful. And so the more practical approach that most people end up using and that works fine, there's no reason not to do this, is the Ventipulmin Syrup. This is clenbuterol. It's an oral version, and it does affect the whole body instead of just the lungs. So you do get some more potential for side effects, like kind of jittery, nervous, sweating, high heart rate, colic kind of things. But usually that can be avoided by starting with a low dose and increasing only as the horse tolerates it. So these ones will all help open the airway. They will help the horse stop coughing. They will help the horse feel better, but they don't treat the underlying disease at all. As soon as you stop them, everything will go right back to where it was. So these should be used sparingly for short term to control bad signs and not without other treatments. So you should also be changing the management and or giving steroids. So then the medications to treat inflammation in horses, we're really stuck with steroids. And people, there are fancier things that have come on the market in the last few years, and we're not there yet with horses. So steroids are our mainstay. And there's, again, 3 different ways to give them. In this case, when you have an acute flare or a severe attack, we really recommend oral steroids. They do the best getting to the whole lung and tamping down the inflammation fastest. And so you should start a treatment course at least with oral steroids. Then you can do longer term treatment, either maintenance treatment or continuing that initial course with inhaled steroids, either through an inhaler system or through a nebulizer. That being said, there are some cases where we want to avoid oral steroids. So steroids can sometimes be associated with laminitis or founder in a horse. And so if your horse has a history of previous founder, or if they have a disease that predisposes them to founder, like metabolic syndrome or Cushing's disease, then we might be a little bit more cautious about starting here, and we might start with inhaled steroids. The inhaled steroids stay in the lung pretty well and don't affect the rest of the body as much, so they are safer in that respect. In terms of the inhaled options, there is new in the last year now an FDA approved inhaled steroid for horses for asthma. It's called the Servo Inhaler, and this is an example of it. It has a little tube that goes up the horse's nose about an inch, creates a seal, and you give your puffs that way. And I haven't personally used it yet, but they say horses tolerate it pretty well when you train them to it. It's the same with all the other spacer type devices. Most horses learn to tolerate it. And this drug has good evidence behind it for working well and for having very little effect on the rest of the horse. It really stays in the lung quite well. So this is sold as a 10-day course of treatment with the hope that it tamps down the inflammation and then you change the environment in the meantime. A lot of horses are going to need longer than 10 days, so you might have to repeat this dose, or you might need to switch to some other product, or you might start with oral and then finish up with 10 days of this. There's a lot of playing around with what your specific horse needs. So I'm giving you kind of the framework here, and you would have to work with your veterinarian if your horse has asthma. And then the other option is nebulizing. There's more and more data coming out these days about appropriate doses and how well it works. So you can nebulize steroids, and it seems like they work pretty well. The type that you tend to nebulize still get out into the blood a little bit more than this Servo inhaler does. So they're not as low risk as the inhaler, but they're still a valid option. In terms of cost, the oral medications are probably easiest to give and cheapest, which is nice. It's about $50 a month, maybe more, maybe less, depending on how severe your horse's disease is. The Servo inhaler is about $400 for a course of treatment, so it's definitely not cheap. It's something you turn to when you really want, I think, the safety profile. And then the nebulized steroids, again, you have a big financial input to buy the equipment, but then it's about $40 or $50 a month for the drugs themselves. So if you have a horse that needs long-term treatment, something like the nebulizer could be a good option. Now, one thing I will comment on with this Servo inhaler is a lot of people are complaining about it because it comes as this single-use device, not single-use, single treatment course device. So you get this one plastic unit, it has the medications for 10 days, you use it for 10 days, and then you throw away the whole thing. And a lot of people, I think, mistakenly think that a big part of the cost is the plastic unit, and they feel like they're throwing away money when they throw away the device at the end. And it's really not. The plastic is a tiny part of it, and it has to be that way to meet FDA guidelines. It has to be that way to make sure that your horse is getting the right dose every time. And they did try to test it for reusing and replacing the cartridge, but it's the same for people. You get an inhaler, it comes with the plastic carrier, and you don't take the unit out and get a new one. You toss the whole thing at the end of the inhaler. So it's the same concept for horses. And I don't think that that should be a reason to stop you from using it. There are a variety of other inhaled steroids where you use the human puffer and the spacer again, and they're all just as expensive. So again, I don't think throwing away the unit should put you off from this product at all. Okay, so those are the two major classes of treating. First, you do the environment, then you manage the acute symptoms with your albuterol or clenbuterol, and then you treat the inflammation with your steroids. Then there's the extra stuff. So people always ask about supplements. There's a million supplements on the market. Major supplements, especially if you have any financial concerns, focus your efforts on actual medications and skip the supplements. A lot of them, I could get in trouble for saying this, are somewhat predatory and will sell you things that really have no utility or no science behind them. The one exception in the case of asthma is there was a study that showed that omega-3 fatty acids can, in combination with fixing the environmental exposures, reduce the severity of asthma. So not when it's just the supplement, but if you do the supplement and change the environment, you get a better response than just changing the environment. The key here is they tested actually this particular supplement, the Alira respiratory supplement, and it has an unusually high concentration of this DHA, which is docosahexaenoic acid, which is a particular type of omega-3 in a very large amount compared to other supplements on the market. So you need to find, if you're getting a supplement, you need to find not only omega-3s, but particularly DHA, and they are typically listed out separately on supplement labels. And you need to look at how much the horse is getting, because a lot of them will be like 0.1 grams per day as opposed to 3 grams per day. So that's my point on supplements. And then we always get the question about allergy meds. So especially if you have an experience with human asthma, it's so much about allergies and allergy shots and antihistamines and other types of antihistamines and all this stuff. And unfortunately for horses, it doesn't work as well. It is still an allergic disease, but it's a different pathway of allergy, and they don't respond as well. The rare horse might respond, but for the most part, it's not worth your time and money and effort. So that is a big difference from people. So there's not usually much sense to doing allergy testing. If you do allergy test horses, they almost all come up allergic to all their hay and everything they're eating, and very few, if any, show any difference in their life if you change their hay to avoid those allergens. So I think that this is just not part of our toolkit for asthma in horses. So to summarize, mild asthma probably doesn't progress to severe asthma, may self-cure, but the treatments are still pretty similar while they're having signs. Moderate to severe asthma is a lifelong condition. You don't cure it, you just manage it, but you can get them into remission if you really address their environment and leave them stuck outside all winter, no matter how cold it is. The horses will be fine, you'll be cold. So again, environment, as much as you can, try to address it by reducing their triggers so that you use less drugs over their lifetime. And then my last personal plug, having asthma is I can say it's very uncomfortable. Even if you're just coughing a few times, usually your lungs are hurting in between, at least mine are. And when you're breathing hard and a horse that has that heat line, their abs are probably sore because they're really physically working hard. So I would say to have a little compassion toward these horses, maybe don't ride them if they're having a flare, and that at least when I was brought up as a horsewoman, there were plenty of barns I went to where there was a horse that would be breathing a little hard, would have a heave line, would have some nostril flare, and it was just, oh, that horse has heaves. That's how he is. And I would encourage you to look at those horses and say, I can do better, I can help that horse, and really try to manage it so that they're not feeling like that all the time. That's my little soapbox. Okay, happy to take any questions.
Thank you very much, Dr. Tomlinson. There are a few questions, and I'll probably first ask one you just touched on, and I think she probably answered a question for the most part, but she was essentially asking specifically about cetirizine, and is maybe wanting some more details on why most of the horses with asthma don't tend to respond to cetirizine or antihistamines, more generally speaking.
Yeah, so it's one of those quirks of the immune system that we can't tell you exactly why. We can just tell you it's different. So in people, there's more involvement of histamine, which is what antihistamines are for. And they get activation of a different type of cell, more eosinophils. And for whatever reason, the pathway of allergy that horses have is through neutrophils, and those are not stimulated by histamine. And so antihistamines have very little effect. There are some horses with asthma that do have more of a component of histamine, and those horses may benefit from cetirizine, but it's much fewer. So it wouldn't be my starting place. It might be something that on the BAL test where we look at the type of cells, if you saw more eosinophils or perhaps more mast cells, you might add on something like an antihistamine, or there's some specific drugs for mast cells. Won't go into that, it's not that common. But for the average horse with asthma, it's like a supplement that won't work. It's spending money that you would better use in other places.
I'm going to jump in here too. And ask you to talk a little bit more about maybe contrasting asthma with allergies. Some of the other questions that were sent in are, for instance, like, are horses with skin allergies more prone to asthma, or is asthma a result of an allergy to hay?
Yeah, it becomes a tricky question because the way we talk about allergies in people is a little bit different than the way we understand or can prove allergies in horses. So you'll often get a horse that has like little runny eyes or runny nose and say it has allergies, or there's a lot of confusion about the disease of head shaking in horses. If you've heard about that people call it allergies because they often snort a lot, which sounds kind of like a sneeze. Some of that, like the runny eyes and nose, we presume is allergies like hay fever that people get, but we don't have good evidence for that. Skin allergies, we do have evidence for when they get hives. Those respond to antihistamines. They also respond to steroids, and they respond to allergy shots sometimes. And that is more of the classic histamine mediated allergy. So it's a different pathway than asthma. And as far as I know, there isn't a connection between a horse having hives, that type of allergy, and developing asthma. At least not, I mean, there may be some in that there's a genetic predisposition toward allergies in general, and those may tie together some, but on an individual horse basis, no, I don't think it's a big connection.
And then someone is asking, I think kind of to do with your comment on, round bales and how they're positioning their head relative to the feed. Someone's asking whether position in the stall, for example, is it better to feed low on the ground, both for hay and concentrates?
That's a good point. So horses have such a long neck that for them to clear gunk and particulates and mucus out of their lungs, they have to put their head down to the ground, and gravity actually helps all this stuff flow out. So to some extent, yes, feeding on the ground is always better for them. To the extent that a horse has asthma, they're going to have asthma whether you feed them on the ground or you feed them up in a hay feeder. So it's better, but they're still kind of both bad. For pellets, I don't think it makes a big difference because, the highest you're going to feed pellets is kind of chest height. It doesn't take them that long to eat, and they'll put their head down to scarf up whatever little nibbles that they've knocked out of the bucket. So I don't think it's a big deal for pellets. For hay, I'm not a big fan of the overhead feeders because it puts them in an awkward head position. It does prevent the draining from having their head down. But like a hay net on the sidewalls, as long as it's not hung real high, I think that's fine. And there's quite a few corner feeders or stall mounted feeders now that are intended to be set lower, but those also encourage your horse to put their head down and bury them in the hay. So I'm not a fan of those either for a horse with asthma, even though they may be good for keeping your stall tidier.
That's a good point. And a lot of those slow feeders are used for obese horses as well. So that can become kind of a battle probably between Yeah, good point. Let's see, we have a question regarding a horse who has coughs all year round, worse in the summer. Also when exercising, especially in canter. He does get some kind of inhaler. It doesn't say whether it's albuterol or steroids, but it hasn't helped. They do wet his hay, and they're basically asking, what else do you advise? I think I can predict what you might say.
So without knowing what kind of inhaler you're giving, I'm not sure how much to say. I do think that if the horse is coughing that often, he probably has asthma, but it would be worth having your veterinarian re-examine and maybe do some of those additional tests to confirm that's what it has, and go through the management with you, see if there's anything else that can be improved in your barn. And then it may be that he's not on high enough dose of steroids. It may be that you've never really kind of knocked it back fully, and maybe he needs an oral course of steroids to really tamp it down and then go on to maintenance. Like people, some horses respond better to one steroid than another. So it may be that he doesn't like that inhaler you're giving him and he needs a different inhaler, or maybe maybe he's really not good about breathing it in when you give the puff, and you would be better off with a nebulizer. So there is, I made this all sound simple, but there is a lot of just playing around and trying things. If your horse is worse during the summer, then you may also need to try, is he better if I bring the horse into the stall during the summer, maybe as a summer pasture associated, or is he better being out all the time? And you'll have to try different variations and see which one works best for that horse. If wetting the hay isn't enough, again, you can try a period of an all pelleted diet. Sometimes that with amping up the medications is enough to get everything tamped down, and then you can go back to wet hay and they'll do okay with it. Sometimes they have to stay on pelleted food for the rest of their life.
Great, thank you. We also have an interesting question. I wouldn't have thought to ask this, but someone's wondering whether their horse who has apparently a nasal septal defect of some kind, whether that can impact a horse who has asthma. I think they're essentially asking like upper versus lower respiratory problems and how they affect each other.
So I don't know if you're talking about like a rhinos or something, or they've had sinusitis before, but
she just says a septum deviation.
Okay. They can make each other worse, but they're not. So like having a septal deviation or rhinos or whatnot won't cause the horse to have asthma, but it already could narrow the airway. So then if they also have asthma, then like a milder form of asthma may look worse or be a bigger problem for that horse because they already have a small nose to get air through. Because that's, when the horse is flaring their nostrils, they're trying to get as much air in as possible. So if you have a restriction in the lung and a restriction in the nose, it's going to be harder for that horse. But it's not that the nose is causing the asthma.
I have one more on my list of the questions that were submitted in advance, asking for some ways to manage dust inhalation while riding in an arena, or some things maybe you could do while you're riding your horse in an arena. And also asked, are nose nets helpful?
Those are good ones. So as far as I know, the nose nets are not fine enough mesh or close enough seal to really keep out dust. The nose nets are intended for horses with head shakers, and what they're putting a touch on particulates. In terms of managing dust in the ring, again, this is going to be real hard if you're not the barn owner. Or
Joy, can I interrupt you quick and ask you to to say that one more time? I don't know about for other people, but for me, you froze up there for a minute.
Where did
You're
you
back
lose
now.
me?
Just the end part of your nose net explanation, head shakers versus, and then you kind of cut out.
Okay. So the nose net puts touch on the nose, and that deals with the head shakers, but it doesn't provide, it doesn't stop them from inhaling particulates. If you think about all the debate there's been about coronavirus masks, you know that a lot of them don't stop. And this isn't even cloth, it's kind of an open mesh. So that probably won't help. Then dealing with the dust is going to be hard if you're a boarder and you're not in control of things. So it may mean moving to a different barn, but options that are out there are watering the arena before you ride to keep the dust down. There's a number of footing products now that are like wax coated sand that have basically no dust. I put one of those in my ring for my lungs and it's lovely, but it's a big investment. If you have outdoor riding, that's better than indoor whenever you can, especially if you can ride on grass. There's a lot less dust there. Those are the big ones. I don't think there's any sort of mask you're going to be able to put on your horse to help. It's just finding a barn that has a well-ventilated arena. If you have an indoor that they're willing to open it in the winter to let it air out. Places that like turn the horses out in the ring, so there's hay and urine and manure in the arena, those are probably going to be worse for your horse. So just looking for a place that has good arena maintenance, waters it, keeps it open, those are best. And then one thing I forgot to mention earlier is time frames. When I say leaving the horse out 24/7, it only takes a few minutes inside the barn to trigger an asthma flare. So if you have a really bad horse, you may need a place where you can tack up outside even, that you don't bring them in at all, because it really takes almost no time to feel it in your lungs, like, oh, I'm inside now.
Yeah, from personal experience, I can tell. Yeah.
I walk into the hospital. I'm literally allergic to work. It's quite nice. I walk into the hospital and 2 minutes later, I'm like, oh God, there's hay.
I'm the same as well, actually, and I suspect it's unfortunately somewhat common in horse girls and equine veterinarians. I bet a lot of people on the call can relate. So I think we've gone through all the questions that people have submitted. So thank you very much, everyone, for attending. And as Sarah mentioned, next month we'll hear from Dr. Toby Pinn on emerging infectious diseases, and we'll send out some information. In addition, this recording of Dr. Tomlinson's talk on equine asthma will be up on our YouTube playlist. I put that in the Q&A, but you can also search for it on YouTube or Google. And so you can listen to Joy's advice on asthma indefinitely. So thank you very much, Dr. Tomlinson.
Thank you, Dr. Tomlinson,
for sharing with us. And we'll see you guys again next month. Take care, everyone.
See you next month. Thanks, everyone.
Thank you.
Bye. You're getting some thank yous in it.